Okay, so Dr. Swanson recently said something, well, kind of controversial in the medical education world. He suggested that all pre-med students, every single one, should be required to major in, and I'm quoting here, health systems transformation. A major that, by the way, doesn't even exist yet.
Wait, doesn't exist? So he's proposing a concept as a requirement?
Exactly. And as you can imagine, he got a lot of pushback for that. People were asking why force students into a major like that, especially when we've always said pre-med students can major in anything they want. I mean, you've got future doctors studying art, philosophy, biochemistry, you name it.
Right. So even Dr. Swanson, when he was pre-med, majored in something pretty unexpected, huh?
Philosophy, yeah. Which makes sense because building critical thinking skills is so important, just like understanding the history of medicine. But his suggestion? A lot of people think it's too niche or, impractical.
Okay, and hey, I'm saying this as the curious outsider here. What does health systems transformation even mean? Like, it sounds big and important, but it's also kind of vague.
Great question. And actually, we heard from one of our listeners at GringoViajero on YouTube asking the same thing. So don't worry, we're going to dive into that in this episode.
Awesome. Also, quick sidebar here.
Oh no.
I know. But we need to give this little disclaimer. We're, AI voices hosting this podcast.
We are. If you're feeling hesitant or, let's be honest, slightly creeped out, that's totally understandable. But know this, Dr. Swanson, the creator of this podcast, hears your concerns and agrees. He's just trying out a new way to reach people, and honestly, we're excited to help share his ideas.
Exactly. So, if you're here for the content and, a bit of responsiveness, we hope you'll stick around. All right, back to the big question.
What does this idea of health systems transformation even entail?
Great question, Sophia. So, health systems transformation, it sounds ambitious, right? Why does Dr. Swanson think it's so crucial that it should become a mandatory major for pre-med students? Couldn't it just be like an optional course or even an elective instead?
Because our health system isn't just broken, David. It's, fundamentally misaligned. Look, doing what we've always done, training doctors to only think about patient care as isolated from the bigger system, it's gotten us exactly where we are now, which frankly isn't great.
And where we are now is
a system that's wildly inefficient, riddled with disparities, and overly fragmented. I mean, take a simple example. Okay, maybe not simple, but something like access to care. We know millions of people don't have primary care physicians. Why? Partly because health systems aren't designed to prioritize preventative medicine over profit. Physicians come into this system trying to care for individuals, but they often don't have a clue about how the system itself works, or really doesn't work.
That feels kind of huge. So you're saying doctors go through med school, residencies, everything, and still don't understand the very system they're operating in?
Exactly. Think about it. Medical school and residencies are so consuming that it's nearly impossible for future physicians to, step back and ask bigger questions about the why and how of health systems. Things like, why are hospitals structured the way they are? Why do some communities get world-class care while others don't have a single clinic? These aren't questions med schools prioritize, even though they should be foundational.
Wait, hold up. Isn't that
frustrating? Yes.
Yeah, but also, isn't that kind of a systemic issue in itself?
Bingo. It's a vicious cycle. Physicians, administrators, anyone making decisions, they end up so focused on immediate tasks that they miss the bigger picture. That's exactly why a curriculum like health systems transformation could be revolutionary. If we had, an army of doctors, nurses, administrators, whatever, trained to think about these things early, it could totally change the way healthcare operates.
Army, I like that. Like a specialized task force?
Exactly. One that actually understands the data, applies evidence, and, most importantly, thinks creatively about solutions. And we're not just talking about pre-med students here, by the way. This should apply to anyone studying health administration, nursing, even public health. They should all at least minor in systems transformation. It's that critical.
Okay, so legit question. What kind of evidence do we have to back all this up? Like, are there numbers that prove this kind of education makes a difference?
Oh, absolutely. Studies have shown that healthcare systems led by professionals who understand these deeper dynamics, things like policy, management, and equity tend to perform better across the board. Better health outcomes, lower costs, fewer errors, and, let's not forget, countries with more integrated approaches to healthcare often register higher satisfaction rates overall. When you invest in understanding systems, you see results. It's that simple.
So the missing piece is getting people to understand that earlier, before they're totally caught up in the grind of patient care?
Exactly. If we can embed this approach at the pre-med or undergraduate level,
Or even sooner?
sure, then we'd start to see a generation of healthcare professionals with the tools to actually transform our system. And honestly, it's long overdue.
So, if embedding health systems transformation into education is the way forward, where do universities fit into all this? I mean, aren't they mostly just places where students learn and professors focus on research and publishing? How do we get them to prioritize this kind of change?
Not quite, David. Universities are actually well positioned to be linchpins in the health ecosystem. Think about it. Beyond educating future healthcare professionals, they have this incredible infrastructure for research, collaboration, and innovation. They can serve as catalysts for real-world change, not just, academic exercises.
Wait, how so? Are we talking about, like, creating a new major or something?
It's about so much more than just academics, though that's part of it. Universities need to be active players in health systems transformation. That means fostering partnerships between faculties, developing collaborative research that addresses real-world health challenges, and even mentoring the next generation of changemakers. They have to step into the arena, so to speak, and engage directly with health systems.
All right, you've got my attention. But what makes a university capable of stepping into the healthcare fight? Like, don't most professors do research because they have to?
Well, sure, but the key is aligning that research with pressing issues in healthcare. Imagine if universities actively worked alongside hospitals, clinics, even policymakers to tackle these problems. We're talking about creating environments where innovation isn't confined to a lab but is immediately applicable, like designing policy recommendations, refining care models, or testing interventions.
Okay, but does that actually happen? Or are we just throwing out wishful thinking here?
Good question. It's happening in pockets. Some universities are already engaging in this way, but it's far from widespread. For example, universities that establish partnerships with local healthcare providers and create internships or mentorships for students aren't just preparing students, they're embedding themselves into the community and actively contributing to systemic change.
So, it's less about creating some kind of health systems transformation major and more about universities becoming players in the system themselves?
Exactly. And when students graduate, they're not just stepping into healthcare completely focused on patient care alone. They're stepping in with a systems-level understanding. Suddenly, they know how to work within the system and, better yet, how to change it. Imagine the ripple effect that kind of preparation could have.
Kind of like a university becoming its own little health innovation hub?
Exactly. When universities embrace that role, they're not just educating, they're transforming the entire conversation around health ecosystems. And the impact reaches from individual patients to entire communities.
Okay, but let's make this tangible because it's starting to sound huge. Do we have examples of institutions doing this well?
Great question, David. One standout example is Arizona State University. They've truly emerged as a leader in connecting academia with healthcare and health policy. What really sets them apart is how they've incorporated innovation into their core mission, making them a blueprint for how universities can lead systemic change.
Wait, how exactly does that work? Like, are we talking about a specific program they offer, or?
It's actually more about their philosophy. They have this thing called the College of Health Solutions, which takes a systems-level approach to health, and they're big on interdisciplinary collaboration. For instance, they bring together healthcare professionals, policymakers, and researchers under one roof to tackle real-world problems, things like reducing health disparities or improving community-based care models.
Okay, but what does that look like day to day? Are students sitting in on policy meetings or something?
In some cases, yes. They have these hands-on experiential programs where students work directly on community health initiatives. So, instead of just reading a textbook about preventive care, they're out there helping to design and implement solutions in underserved areas. It's education that goes well beyond the classroom.
That's incredible. So they're kind of creating this ecosystem where learning and real-world impact happen at the same time?
Exactly. And that's the mindset we need more of. Now, on a smaller scale, there's another great example from Bond University in Australia. They offer something pretty unique, a Bachelor of Health Transformation. It's specifically designed to prepare students for careers that demand a transdisciplinary understanding of health.
Okay, pause for a second. Bachelor of Health Transformation? That sounds futuristic.
It kind of is, but it's also incredibly practical. The program immerses students in everything from healthcare design to policy development to systems analysis. By the time they graduate, they're not only ready to work in traditional roles like health administration or public health, they also have the skills to rethink how these systems operate.
So you're saying they're training people to wear multiple hats and maybe reinvent the hats while they're at it?
Exactly. And that flexibility is critical if we're serious about creating a healthcare system that's equitable, efficient, and responsive to real-world challenges.
All right, I'm sold. But, and maybe I'm jumping ahead a bit here, it sounds like what we're really talking about is making health systems transformation its own field of study, right?
That's exactly it, David. If we're serious about making health systems transformation its own field of study, we have to start by defining what success looks like. And in any healthcare system, it really boils down to three things: health, equity, and efficiency. Now, achieving all three at once, that's where the challenge lies.
Why do you think it's so hard? I mean, it sounds pretty straightforward, doesn't it?
Well, it sounds straightforward because the vision is clear. But that's the thing, it's one thing to have a vision, and another entirely to align everything to make it happen. And historically, we've allowed other factors, like profits, tradition, or institutional inertia, to overshadow what should be our shared goals.
Okay, hold up. What do you mean by institutional inertia? Like, we're stuck doing things the way they've always been done?
Exactly. Think of it like this. Healthcare has been built, layer by layer, on conventions and systems that were never designed with today's challenges in mind. But instead of stripping away what doesn't serve us anymore, we just keep adding duct tape to make things work. It creates this tangled mess that doesn't actually serve our core vision: health for all, at the lowest cost, with the best outcomes.
Right, so it's like the system keeps growing, but no one's asking the big question, is this even working?
Exactly. And that's why a relentless shared vision is so powerful. When everyone, students, professionals, policymakers, can agree on what we really want, it makes it easier to challenge those inherited systems and say, wait, is this getting us closer to health, equity, and efficiency? If it's not, it needs to change.
But don't you think there's, like, resistance to that kind of thinking? I mean, people in medicine probably feel like the system is too big to change.
Absolutely, but that's why it's so important to instill this vision early, before students become so entrenched in the system that they can't see the bigger picture. If they can start out understanding that health, equity, and efficiency are not just buzzwords but tangible goals, everything else, institutions, practices, policies, should adapt to serve those goals, not the other way around.
And if it doesn't align, it's got to go.
Right, this isn't about holding on to tradition for tradition's sake. It's about what actually works to create health, equity, and efficiency. And once students, or anyone in the field really, internalize that vision, they start thinking differently, they question the status quo, and that's how change happens.
Wow, that kind of mindset shift could be huge.
Exactly, and it's a shift we desperately need if we're serious about transforming healthcare.
All right, so if we're talking about questioning the status quo, one thing I've been wondering is, how did the system even get to this point? Like, when did healthcare start getting so, I don't know, complicated?
Great starting point. To understand where we are today, you really have to go back about 100 years, maybe even earlier. Back then, the biggest health threats were infectious diseases, things like tuberculosis, cholera, and smallpox. Medicine focused on treating episodes of illness more than preventing them, and honestly, that shaped a lot of what we still see today.
Treating problems as they show up instead of preventing them in the first place.
Exactly, and because of that, the medical education system started prioritizing what's called biomedical reductionism. It's this idea of breaking health down into purely biological processes, focusing on symptoms and treatment in isolation, instead of looking at the bigger picture of health, social factors, community impacts, all of that.
Wait. Biomedical reductionism? You've got to unpack that one for me.
Sure, it basically means reducing health to just biology. So rather than seeing a patient as part of a community or influenced by socioeconomic factors, doctors learn to treat the disease almost like it exists in a vacuum. It's efficient for certain things, like surgeries or acute infections, but it doesn't work as well for chronic, long-term issues like diabetes or heart disease, which are tied to lifestyle and broader system issues.
Okay, but is this where professionalism comes into play? Like, how did that impact all of this?
Professionalism, yes, but not in the sense we think of today. Back then, the rise of medical professionalism was more about improving the quality of doctors, which was desperately needed. It standardized education and set higher benchmarks for care, which was great. But it also reinforced this idea of doctors being hyper-specialized, focusing narrowly on isolated episodes of illness, and that's a big reason why our system evolved the way it did.
Right? So professionalism created better doctors, but it also created blind spots?
Exactly. And then you have another layer, the tie between insurance and employment. During World War II, companies couldn't raise wages because of regulations, so they started offering health insurance as a perk instead. Fast forward, and suddenly your access to healthcare depends on whether you have a job with benefits.
Oh, wow. So it wasn't even planned. It just kind of happened?
Exactly. And what's troubling is how much we lost sight of what we really wanted as a society. Health took a back seat to systems that prioritize profits or convenience, and now we're dealing with the consequences. Chronic illnesses like diabetes, skyrocketing costs, and outcomes that, let's be honest, aren't where they should be.
So it sounds like what we're really grappling with is an entire system built for a different era.
And one that hasn't adapted to our needs today. It's why rethinking the foundations of how we approach both health and care is so crucial. We've got to ask what we actually want and work backwards from there, instead of just patching up systems that were never designed with today's challenges in mind.
So, Sophia, thinking about how systems need to evolve, I'm reminded of how some of the biggest shifts in history came from large-scale social change. Abolition, civil rights, even how the tech industry transformed our day-to-day lives. Is that the kind of foundational shift we're talking about here?
Exactly. Social change happens when a society shifts in its fundamental structures or norms. And you're right, those big movements like the abolition of slavery and women's suffrage are prime examples. They reshaped not just laws, but what people believed was possible. But the key, David, is that these transformations didn't just happen on their own.
Right? Like there wasn't just this magical moment where humanity collectively went, okay, this is wrong, let's fix it.
Exactly. These changes required activism, persistence, and importantly, evidence. For example, abolitionists used data and personal narratives, documents like slave narratives, or economic analyses, to convince people of slavery's moral and practical failings. Women's suffrage, suffragettes organized campaigns, utilized the press, and tied their movement to broader social reforms of the time. Their success wasn't just about outrage, it was about winning hearts, minds, and policies.
So you're saying evidence-based strategies were like their secret weapon?
Absolutely. And today, we still use the same principle. Evidence informs social movements and makes them persuasive. One fascinating modern parallel is the evolution of the tech industry. In the 1990s and early 2000s, big shifts like the rise of Silicon Valley didn't just happen because of cool gadgets. Entrepreneurs and policymakers worked together, using the success of early startups to make a case for investment in tech ecosystems, backed up by data showing the potential economic impact.
Okay, but wait. Wasn't there also kind of a fake it till you make it vibe in that era? Like people pitching ideas they hadn't actually built yet?
Oh, definitely. But what's interesting is that even those fake it till you make it moments were often underpinned by optimistic projections based on evidence from other areas, like how emerging technologies, when scaled, could potentially transform industries. It was still storytelling, but with numbers to back it up. That's what made investors listen and social buy-in happen.
So whether you're talking abolition, suffrage, or Silicon Valley, It's about telling the right story but anchoring it in cold, hard stats?
Exactly. And here's the kicker. Every one of those movements depended on people with the courage to challenge the status quo. They looked at their systems and said, "This isn't working. We've got evidence to prove it. Let's change it."
It makes me wonder, were these trailblazers just wired differently? Or was it like a skill they built over time?
I'd argue it's a mix. Some people are naturally inclined to push boundaries, sure. But building a movement, or even just getting others to believe in change, requires developing certain skills: critical thinking, collaboration, and using evidence to make an unassailable case for reform. They didn't do it alone either. They rallied communities, which amplified their voices exponentially.
And probably inspired the next wave of disruptors?
Exactly. Each movement builds on the lessons of the past, evolving strategies and tools. Social change isn't linear, it's iterative. It grows, adapts, and finds new ways to address whatever challenges the moment demands.
So, here's the big question. How do we bring that same level of boldness and strategy to healthcare? Because man, it feels like it's overdue. All right, so when you bring up systems thinking in the context of healthcare, I can't help but picture gears turning in some big complex machine. But healthcare doesn't seem mechanical like that. It feels much messier, right?
Exactly. Healthcare isn't a machine, it's what we call a complex adaptive system. Instead of fixed parts working predictably, it's made up of interconnected elements that constantly adapt. Patients, providers, policies, even societal trends. They all interact in ways that are unpredictable and sometimes a little chaotic.
Right, so it's less like gears and more like herding cats?
Pretty much. And that's why systems thinking is so crucial. It helps us step back and appreciate that health isn't just about individuals or isolated treatments. It's about how everything, policy, environment, even culture, comes together to shape outcomes. In a sense, health is a team sport, not an individual endeavor.
Wait, hold up. A team sport? You're saying my annual checkup is like the equivalent of me passing the ball to my doctor?
Kind of. I mean, your health is more than your doctor's advice or your individual actions. It's influenced by your access to healthy food, safe housing, even policies around public health funding. All of these team members come into play.
So it's not just me keeping myself healthy, it's the whole system working together to make health even possible.
Exactly. And that's the challenge. Healthcare was traditionally designed around episodes, like surgeries or short-term fixes. But healthcare is different from health, which unfolds over a lifetime and is shaped by a wide range of interconnected factors. Systems thinking helps us see the bigger picture.
All right, but here's what I'm stuck on. How do you actually tackle something that's constantly changing and adapting? I mean, doesn't it get overwhelming?
It can be, but that's where understanding complex adaptive systems comes in. These are systems that aren't static, they're dynamic, evolving with every new input. The key is recognizing patterns and leveraging points where a small change can make a big impact. Think of it like this. Instead of trying to control the tide, you find ways to navigate with it.
Ooh, I like that. So instead of fighting the messiness, you kind of work with it?
Exactly. For example, during the pandemic, we saw communities adapt their health systems almost overnight, rolling out testing sites, adjusting hospital protocols, ramping up telehealth services. Those were responses to a rapidly changing environment, and they're perfect examples of how a complex system can adapt when needed.
Okay, that makes sense. But why does this perspective matter so much in transforming the larger health system?
Because without it, we're stuck treating symptoms instead of addressing root causes. If we focus only on fixing individual problems like how do we improve wait times in the ER, and not on the bigger system, we miss opportunities for lasting change. Systems thinking shifts the focus to the whole rather than its parts.
And once you see those patterns, you can find ways to improve the whole game, not just patch up cracks.
Exactly. It's about designing for resilience, equity, and adaptability, so the system can meet current needs and future challenges. This mindset is at the heart of health systems transformation, and frankly, it's the only way we're going to see meaningful progress.
You know, Sophia, the way you explained systems thinking got me wondering, where does public health fit into all of this? Should public health be included in the health systems transformation curriculum? And maybe this is my tech brain talking, but what exactly does public health mean? Like, isn't all health technically public?
Great question, David. Public health is really about looking at health on a population level. Instead of focusing on treating individual patients, it's about preventing disease, promoting health, and improving outcomes across entire communities or societies. It's that big picture approach that complements the one-on-one care doctors provide.
Okay, got it. So it's like treating the community as the patient instead of just one person?
Exactly. And that approach is critical, especially when we talk about the burden of disease. For example, measuring DALYs, disability-adjusted life years, is one way public health looks at the big picture. It combines years lost due to early death and years lived with a disability, giving us a fuller understanding of how diseases impact people's lives and society as a whole.
Wait, dailies? I've heard that term before, but can you give me a real-world example? Like, what are the major contributors?
Sure. In the U.S., we're looking at chronic illnesses like heart disease, diabetes, and depression as leading causes of DALYs. These conditions don't just shorten lives, they affect quality of life in huge ways. And because they're so prevalent, they place a massive strain on our healthcare systems and economies. Pre-med students need to understand this.
Wow. So, it's not just about how many people are sick, it's about how much of their life they lose to illness, right?
Exactly. And it's not just about the numbers, it's about the trends. For example, as life expectancy increases, we're seeing a shift in burden from infectious diseases to chronic conditions. Public health helps us identify these patterns and adjust strategies, whether it's through policy changes, community programs, or even how we design healthcare systems.
Okay, but here's what I don't get. If we know the big drivers of disease, why aren't we focusing more on prevention? Like, shouldn't public health be steering the ship?
That's the million-dollar question. Prevention is often far more cost-effective and frankly humane than treatment. But the way our system is structured doesn't always prioritize it. Public health often ends up underfunded or undervalued compared to acute care, even though it has the potential to make the biggest impact long-term.
So, it's like we're trying to fix a flood by mopping up water instead of turning off the faucet?
Exactly. And this is where the structure and activities of the health system come in. It should adapt to meet the needs of the population, whether that's addressing rising obesity rates, responding to mental health crises, or preparing for emerging infectious diseases. But doing that requires a public health mindset rooted in data and systems thinking.
So, if we're serious about transformation, public health has to be front and center?
Absolutely. Remember, individual outcomes are deeply tied to systemic factors like housing, education, and access to care. Public health connects the dots and makes it possible to address those root causes rather than just their symptoms.
Makes sense. So pre-med students need to deeply understand what drives health status, not only episodes of illness, so that they can help to create a systems that improves health. And it sounds like some of the solutions might already be right under our noses. They just need the right focus and funding. All right, Sophia, you mentioned how systems thinking and public health connect the dots and tackle root causes. It seems like statistics are really the backbone of how we make those big decisions, right? So maybe students should also learn to interpret data and communicate important findings.
Absolutely, David. Statistics aren't just numbers. They're critical tools for understanding what's happening in health and, more importantly, for identifying trends and making informed decisions. But there's a catch.
Oh, always a catch. What is it?
The catch is that stats can create misunderstandings if they're not communicated well. We're living in a time of a crisis of trust. Trust in health professionals, trust in science. It's all taken a hit lately. And part of that is because we've failed to effectively explain the data, especially uncertainty.
Uncertainty? Like the idea that even the numbers aren't 100% clear?
Exactly. In science, uncertainty doesn't mean we don't know anything. It means we have a range of possibilities and our confidence increases or decreases with more evidence. But when that's not explained properly, it can come across as indecisive or even contradictory. And that creates confusion, or worse, skepticism.
Yeah, because people hear uncertain, and they're like, well, why should I believe this then?
Exactly. That's where effective communication becomes vital. Students in healthcare fields not only need to learn how to analyze data, but also how to convey what it means in a way that builds understanding and trust. It's about transparency and acknowledging limits without letting that erode confidence in science.
Okay, but how do you teach that? Communicating stats sounds, I don't know, like its own art form.
It kind of is. That's why scientific communication should be an essential part of their education. It's not just about presenting findings, it's about framing them in context, addressing concerns proactively, and most importantly, making it relatable without oversimplifying.
Hmm, relatable, but not dumbed down. That does sound tricky. Got an example?
Sure, think about COVID-19. Early in the pandemic, experts talked about vaccine effectiveness as percentages, like 95% effective. What wasn't always explained well was that this doesn't mean it's a guarantee you'll never get sick. It means it dramatically reduces severe outcomes. The nuance got lost, and that hurt trust.
And that miscommunication probably made people more hesitant, right?
Exactly. And that's why students, whether they're future doctors, policymakers, or scientists, need to know how to bridge those gaps. It's not enough to know the science. They have to make it accessible and meaningful to the public, especially in moments of crisis.
Yeah, because without that bridge, even the best data won't get through.
Exactly. And trust me, building that bridge is just as critical as the science itself.
All right, Sophia. So if building trust and communication are critical in public health, that makes me think about leadership. It's one of those buzzwords you hear all the time. But when it comes to transforming healthcare, what does leadership really mean?
Great question, David. Leadership in the context of healthcare isn't just about being in charge or having a title. It's about guiding teams, adapting to challenges, and fostering innovation, all while keeping the bigger goal in mind, improving outcomes for people and communities.
Okay, so it sounds like it's more of a mindset than a position?
Exactly. Students need to understand that to improve the health system, we need new types of leadership. We need to move away from the old school top-down approaches to what we call emergent leadership. This is where leadership can come from anywhere, not just from managers or executives. It's about empowering individuals at every level to take initiative and solve problems as they arise.
Wait, so you're saying leadership isn't just one person? It's like a team sport?
Exactly. That's where distributed leadership comes in. Instead of relying on one person to make all the decisions, teams share responsibility. It's more collaborative and allows systems like hospitals or clinics to adapt more quickly to new challenges. Everyone plays a part in steering the ship, so to speak.
That makes sense. But doesn't that get messy? Like, who takes charge when there's a crisis?
Great point. That's where adaptive leadership comes into play. Adaptive leaders excel in situations where there are no clear solutions. Instead of sticking to rigid plans, they focus on experimenting, learning, and adjusting as they go. It's all about staying flexible while still moving toward a clear set of goals.
So, like, being okay with not having all the answers?
Exactly. And in healthcare, that's often the reality. Adaptive leadership is key in moments like, say, a pandemic, where the rules and challenges are constantly changing. Leaders have to stay calm, synthesize new information quickly, and pivot when needed. It's not easy, but it's critical.
Okay, I'm with you. But then there's this other leadership style you mentioned, transformational leadership. What's that about?
Transformational leadership. This is the big picture stuff. Transformational leaders inspire and motivate their teams to aim higher, beyond just meeting goals and checking boxes. They focus on creating a shared vision, encouraging innovation, and fundamentally reshaping how things are done. They don't just lead people, they transform entire systems.
Wow. So they're not just managing, they're reimagining?
Exactly. Think about someone like Dr. Paul Farmer. He didn't just treat patients. He revolutionized how we think about global health equity. Transformational leaders challenge the status quo and empower others to drive change alongside them. That's what makes them so impactful.
Okay, but can you be all of these kinds of leaders at once? I mean, emergent, adaptive, transformational? It feels like a lot to juggle.
It does, and not everyone has to embody all these styles. The point is to understand them and apply what's needed in the moment. The health is complex, and it demands a variety of leadership approaches to address its challenges. There's no one-size-fits-all.
Got it. So, it's about being versatile and knowing when to switch gears?
Exactly. And honestly, that's the beauty of it. Leadership in healthcare transformation isn't about perfection, it's about progress. A willingness to learn, adapt, and inspire others is what ultimately makes the biggest difference.
You know, Sophia, as you were talking about versatility and progress in leadership, it got me thinking. Everything we've discussed so far, from health systems transformation to equity and public health, really ties back to just how interconnected and complex all of this is. It's a lot to wrap your head around, isn't it?
It is, David, and honestly, that's the point. Our health system is messy, and trying to transform it is no simple task. But the key takeaway here is that we can't keep doing what we've always done. If we want different results, better results, we have to embrace new ways of thinking and working together.
Right? But here's what I'm wondering. What's the first step? Like, we've been talking about this army of health systems transformation trained doctors.
Well, maybe not an army, but a movement for sure. Imagine how much could change if medical schools, universities, policymakers, and communities all started thinking in terms of collaboration and systems level solutions. It's not perfect, but it's a step in the right direction.
And maybe it's less about getting everything right and more about starting the conversation, right?
Exactly. Health system transformation isn't about finding one perfect answer. It's about creating the space for change, for innovation, and for constant learning. We'll try things. Sometimes they'll work, sometimes they won't. But it's worth the effort, because doing nothing isn't an option.
Couldn't agree more. And yeah, I want to take a second here to say thanks to everyone who's been connecting with us, whether it's on LinkedIn, YouTube, TikTok, you name it. Your feedback has been amazing, and honestly, it fuels conversations like this one.
Absolutely. These aren't just our ideas, they're built on the questions and insights you've all shared. Together, we really can take steps toward creating a healthcare system that works for everyone.
And on that note, I gotta say, I've learned so much from this episode. Sophia, as always, you were incredible. Thanks for breaking things down in such a thoughtful way.
Thank you, David, and thanks to you for keeping this conversation fun and relatable. You always manage to ask the questions we're all thinking.
All right, and to all our listeners, thank you for tuning in. Keep those ideas and questions coming, because these discussions only get better with your input.
Until next time, take care, stay curious, and remember, transformation starts with all of us.